Well, hello everybody. I'd like to welcome you to this webinar today hosted by SciencePod. For today's session, I'm delighted to introduce our guest speaker, who's Mark Bentham, who's the founder of vHealth. My name is Jeremy Betts, and I'm the head of commercial partnerships here at SciencePod. Now, we'd like to thank you enormously for taking the time to attend this in what has become a pretty chaotic world. I think we can all agree that the demand for digital content has increased exponentially since the start of the year. With certain regions seeing subsequent spikes in new cases right now, it seems that we will indeed be embracing digital channels for some time ahead. At SciencePod, we are a mission-driven company. We're experts in translating complex information from clinical research and making sense of them in clear, concise, and compelling language. We work in a number of formats, including text, infographics, podcasts, video, all of those to deliver our multi-channel programs. Now, something that's at the core of our practice is to invest significant time and effort to assess an array of data from the latest surveys focusing on digital behavior, how it's developing, what's being consumed, what channels and formats are preferred right now, and even down to what times of day HCPs and patients are accessing them, and a number of other critical factors. Basically, all of that we find we've put together and gives us, essentially our team, a deep understanding of the environment and what is required to deliver quantifiable engagement right now. So with that squarely in mind, our latest webinar aims to deliver a comprehensive overview of the current online medical landscape, what we've learned so far, and ultimately offering a variety of nuggets which will significantly enhance your ability to create effective programs in the highly congested world of medical communications. We'll also take you through a unique turnkey solution for Congress planning and execution that I'm sure will be tactical dynamite for all of you out there. Now, our first speaker, Sabine Louet, is the founder of SciencePod. Sabine's a digital media entrepreneur with 20 years of experience in science publishing. Her keen interest in using technology to deliver improved editorial solutions and a vast international experience working across Europe, the USA, and Asia. She's previously worked for international science publishing houses at Nature Biotechnology, as you all know, now part of Springer Nature, and strategic pharma intelligence publishing house Windover, which is now Informa. Following on from Sabine, there'll be Mark Bentham. He's founder of vHealth, who are a tech solutions provider with extensive experience in the healthcare industry. I'll give you a deeper insight into Mark's background in advance of his presentation. But can I also take this opportunity to highlight the Q&A session following both presentations? Please do leave your questions in the sections provided at any point during the presentations, and we'll very much look forward to going through them and discussing. So without further ado, it's a great pleasure that I now hand you over to Sabine.
Thanks very much, Jeremy, for this great introduction. So let us start. Let us dive in. So today we are going to talk about the best way to engage with healthcare professional as well as patient. All this is part of your digital transformation. Everybody has been talking about digital transformation for quite some time. Today, we aim to enlighten you and share our experience and expertise on the best way to go about communicating in an omni-channel manner towards your preferred audience. So before I start diving into the heart of the topic, I'd like first to give you a bit of an overview of the current industry challenges and opportunities when it comes to communicating in a digital world. So clearly, there is certain challenges that have been there for quite some time. In particular, when it comes to accessing the latest on clinical research, there is millions of studies published every year, and the reality is that very few people actually read that content. And that's a bit of a missed opportunity because innovative companies who are very heavily involved in research and development do not always make their research and their activity visible to audiences who need to know. The primary audience of a lot of pharma company or biotech company remains healthcare professionals and ultimately patients, but there are other people in the chain, such as policymakers, investors, health insurers, e-health providers. All these people in the ecosystem also need to know what's going on in your most innovative, in the most innovative part of the companies that you run. So there is a great opportunity at this point in time to engage with your target audience in the digital world. And I think focusing on content that's connected to your latest research and medical information really gives a pretext to engage on an ongoing basis with healthcare professionals and patients. So as you know, in every form of communication that you engage in, there's always a gatekeeper. And the eagle eyes of your legal and medical teams are not to be underestimated. But in a way, the fact that you've got such a high level quality control for every piece of content that you put out there, whether it's for communicating about your clinical research results or whether it's post-product approval when you need to, engage in disease awareness campaign or in other marketing activities, whatever the stage of the process you're at, the fact that there's such a high-level gatekeeper means that you have to very much engage with content that's connected to scientific evidence. So the interest of having evidence-based content from a legal perspective is that whatever you say, as long as it's backed up by scientific study, it decreases the risk to patient, because the closer you are to the latest in research, the better. From a medical perspective, using evidence-based content tends to increase patient outcome, and that's because that content would be more credible, being based on studies, and there is a caveat that kind of content needs to be written in a way that healthcare professional and patient can understand. So I will develop a lot more of these issues in my next slides. So all of you are engaged in communication of a particular kind. So the baseline diktat when you're engaged in any form of communication, medical communication, is to know your audiences. And as you're very much aware, since the lockdown, the preferences of healthcare professionals on how and when they consume medical content might have been evolving, particularly because they are not organizing their day in the same way that they used to, or just because technology, as time passes, makes it easier for them to access certain type of content. So based on the knowledge that we've gathered, in the creation of special content for life science organization, and based on the target audience that we've been reaching, we know that those audiences have got specific requirements. They seek trustworthy material. They go for concise, digestible, and reputable sources of content when it comes to accessing information on the latest research. They also want content that's relevant directly to them, because they have so little time to spare that they do not have time to look around other area of medicine. They just want to concentrate on their own area and get information that may change their practice. We also know that these healthcare professionals tend to consume content in slots of about 10 minutes or less, and altogether they have about 60 minutes per day to dedicate to consuming the content you may be providing. So all in all, these 3 points really emphasize the need to make content available to consume to these healthcare professionals through multiple channels, so that it's available if they want it, when they want it, in the format that suits them best. Another thing that we've learned, looking at the habits of healthcare professionals and how they seek the latest clinical development, is that they have some preferred source of content. And one of them is the medical congresses and medical portals. They seem to have the most votes when it comes to getting trusted, reputable content. That's not to say that they're not accessing information through other channels, and in particular, medical and scientific journals still remain a source of content for them, online searches, as well as peer-to-peer recommendations. So I have this special slide here, and this matters a lot because it really is pertaining to what we've learned from the COVID crisis. And traditionally, a lot of the communication of highly technical information or information related to clinical trial was mainly targeted at healthcare professionals. But what we've learned during the COVID is there are potentially new audiences for that kind of content, as long as it's presented in a digestible way. And indeed, we've seen with the COVID that no medical or scientific concept is too complicated when people really want to understand. And that should make you think as to what kind of content you're going to create based on your own innovation and clinical studies. So now I'm going to share some of the tips that we've learned over the years from creating content for life science organizations. So effective engagement will come from having content of a certain quality. It needs to be created in a way that's highly digestible in bite-sized format. It also needs to have it needs to be readily available, easy to search, easy to access, easy to download. And more than ever, it's important that the content is expressed in multiple formats. So you've got your single message that then gets converted into the video format, the text format, the podcast format, and the infographic format. Another thing that we've learned is for optimum engagement, when you conceptualize your content, it's really important that you think about it as content being consumed within 5 or 10 minutes, no more than that. And of course, on occasion, you can allow for a deep dive into a specialist topic and allow more longer pieces that can take up to 20 minutes to consume. But this should be the exception. The majority of the content would be around 5-10 minutes. So a lot of people ask us, as expert content creators, how do you fight against cognitive fatigue? The fact that people are constantly bombarded with content online. And there is one answer that keeps coming back in our experience, it's quality. In fairness, audiences never get tired of compelling content. And I could maybe draw a parallel here with people going back to watch old Western movies. And that's because Western movies have a good story to tell. They're compelling. And that's why years and years after they were initially used, they're still quite popular just because of the nature and the quality of the content. And in our industry, it's a bit the same. Once you've created quality content and it's compelling enough, your audiences would not get tired of this sort of quality. Now, there are other ways to engage which could give your healthcare professional audiences a bit of a break, is by engaging through visuals. Typically, videos are highly popular, but you can think also about infographics or that kind of visual medium. And of course, not to forget and not to underestimate the value of podcasts. Some people are highly auditive. They prefer hearing things rather than reading things. And I think there's a certain value add in, doing KOL interviews and things of that nature. So now let's get into the heart of things. We've created a turnkey solution with our partner V Health, and Mark will tell us a bit more about this later. But it's really a solution that's specifically designed for your omnichannel digital programs. And I have an infographic here that really shows the chain of events. Remember, we are creating evidence-based content at all times, so our raw material remains those clinical studies, that medical information that's available in pharma companies, in life science companies, and from that raw material, we work our magic, transform and turn these stories into clear, concise and compelling stories. And they're not only compelling, by the way, they're also compliant. Remember, the eagle eyes are still here. So they can take the form of clinical study highlights, infographics, KOL, podcast or video interview, or simply Congress presentation. So all of these material would typically be sent for review by medical and legal. And once this is done, then we've approved content that can be reused. And that's where vHealth come into play. vHealth is a tech platform that allows you to reformat any approved content so that it's suited for omnichannel distribution. And we'll get a live demo by Mark in the second part of this webinar. So what's unique about the SciencePod treatment, so to say, in the conversion from technical to simpler digital asset is that the people in our community have a unique talent. So globally, we have all these medical writers and editors. Their expertise collectively spans all of the therapeutic areas. Not only do they have that scientific and medical expertise, but they also have experience of working for publishers, medical publishers, science publishers, but also sometimes the media, which makes them good storytellers. And that's a really important factor in the overall success of your omnichannel strategy. So just to give you another map of how things would happen, you'd have the content conceptualized and created and quality controlled by SciencePod. And then when it's ready to go, ready to be repurposed and reformatted, then vHealth comes into play. Again, we'll have a live demo to see how this can ultimately be made ready for distribution on all of your favorite channels. So when we get consulted a lot on what format would work for what purpose, people have a lot of ideas on communication campaigns and approach, but I think they don't always know what format works best. And I would like to take this opportunity to focus on the case study of virtual medical events. The reason for choosing this particular case study, as you may recall, is that healthcare professionals consider that medical congresses are among the most trusted sources of information to really keep them up to speed with what's going on in the latest clinical research and ultimately influence their clinical decision making. So I think virtual events are perfect to represent various types of formats that work well in various circumstances. But before we show you some sample, I'd like to share these interesting survey results from a survey done by Medscape on oncologists, asking them whether they were planning to attend ASCO in 2021 if there was no vaccines, and 70% said no. Whereas more interestingly, when they asked the same question in the case of a vaccine being available, still 50% of the respondents said they're not going to attend. So that really goes to show that there is an evolution in how healthcare professionals such as oncologists consider they will reach out to the latest in clinical research in the future. It's not so much about the physical presence. Everything's going online, and this means very good news in that you need to now rethink your digital strategy and rethink about the type of requirement, the content requirement that will be there for you to effectively communicate in a digital world. So now I'm just going to share a few examples of effective content format that we've worked with over the years. So clinical study highlights are always very popular online. They would typically be written in a journalistic style with quotes from the authors. I also wanted to share this particular highlight in Chinese language that was never written in English. It was written in Chinese first, just to show you that once you have your systems and your processes in place to create content, you can create content in whatever language of physician you're targeting, and that's very important that you adjust to the expectation of your audience. Now we've got some data on how effective these kind of highlights of clinical study actually are. They tend to lead to an increase in the original study paper by 300%. They also tend to increase the number of citations by 200%. And then you can think about the case of these kind of highlights being shared into wider audiences through more wider communication, and then you can have up to 5 times the number of downloads when you share beyond the inner circle of healthcare professionals. So these are a very effective format for communicating the latest research results. If you want to vary, you can also base your communication on something different, like an infographic. Remember, we were talking about the fatigue, the digital, the cognitive fatigue. So to vary a little bit, it's important to vary the formats as well. So you can see here that this infographic was based on a single study, and the reference of the study still features in the infographic, but then the entire picture is much more eloquent. Now we'll also would do other type of format, KOL interview in the podcast format, in video format, or indeed as a simple Q&A. These are highly shareable, highly digestible, and when someone likes what they hear, they tend to want to share. And that's how you get engagements from really high quality type stories. So of course you can extend that to medical education content. And the key lessons learned here is that for the content to really do its job and lead to a high level of engagement, it needs to be compelling content. And then you can obviously track various types and formats of content, and over time refine your formula. And so in practical terms, to implement this turnkey solution, we have created a joint solution with VHealth, with 3 virtual event programs for local, national, and international events. And now I think it's time to pass on the mic back to Mark Bentlin, who will tell us a bit more about his own solution.
Super, thanks Sabine. I will try and share my screen. Hopefully you can see that now. All right, great. So before we get started, at the end, we've spent our life at VHealth, and previously we were involved with a lot of remote conversations. And at the end of the day, it often becomes a question of, once you've created great content, now what? The impetus and the push to digital and the increase in the number of emails over the last 7 months since the beginning of the COVID breakout has been phenomenal. There are 6 times more emails, 7 times more remote meetings that are happening. And what that means is that there is an increase for trying to put messages into the physician's inbox as well. So once you've got great content, unfortunately, it's not the end of the road. That's the first key step. And really it's about ensuring that it can be viewed, seen, repurposed, and ultimately made more useful in terms of the physician activity. So we like to call that the Omnichannel Digital IQ. It's about content, and we think that by addressing these key points that we've witnessed over the years, that you can really improve the overall success of the physician engagements and also of the brand itself. And we think it boils down to 7 key factors. And we'll look at these each now. So there's the value in the user experience of the content itself, its relevance to the individual physician, the timing of when they receive it or how they expose themselves to it, how quickly it can be produced or it's reacting to market events, how often and how well it can be adapted or reused to other uses or channels or updates, how well it can be measured, and then what we can do to drive the overall costs of deployment or content significantly lower. So we'll run through a few of these elements along the way, and we'll show you a couple quick examples to give you a sense of how we apply to this world of content. So at the end of the day, you start with where we jump in is once there's already the inception of great content, evidence-based medical content that permits physicians to really be well informed and make preference decisions. The preference, though, is to take that content and turn it into easily digestible formats that can be part of a user experience that can also go above and beyond everybody else that's already sending great content to the same physicians. We need to be able to lift the content experience in order for physicians to participate easily and take home the messages. And we'll share some examples of those as we walk through. In terms of personal relevance, the content that you're developing obviously is going to be targeted at the disease area or the product situation, or perhaps the physician segmentation, but also taking into account their attitude. Can it be personalized? Can it be targeted in such a way where the content itself can be revealing to a physician message? If it is personalized and can be personalized, is personalizable, we've seen that increases the engagement of all physicians. From a timing perspective, is this something that physicians are consuming in between patients during their day? Is it a discovery that they're performing during some other activity? Is it an on-demand, or is it a response to another piece of a planned content journey from a life sciences perspective? So the timeliness and the response to when the physician is getting that content is critical. And in order to do that effectively, it really is about applying more data, gathering more data about content and its usage across the audience where it's possible, and to take advantage of that. Speed is absolutely critical in this new world. The ability to publish new materials. We've seen that the average live remote meeting, is anywhere between 16 and 30 minutes. A lot of content is supporting those discussions. So there's a thirst for new materials, updated materials, and an ability to see the same material in a slightly different light. So how quickly can the content be produced technically? How fast can it work its way through the approvals process? And how easily can we respond to market events or apply learnings about the content to the next cycle of content? So be able to take advantage of material and learnings from the physician audience to adapt and update content more easily, more quickly. So gone are the days of the annual cycle of content. We now need to be thinking of a publishing model which moves the content through much more quickly and much more easily in bite-sized chunks. In order to do that effectively, a lot of the time it's about reuse or adaptation or adaptability. Localization allows all of the markets that are now pushing to digital to take advantage of the content that's perhaps been created for an initial global focus or for one particular market, to be able to localize that material easily. So can we make its usage as wide as possible, as well as adaptable as easily as possible to local regulatory requirements or local specifications for how that content needs to be received. So the total value, if you will, of the content that is created is in part impacted by how easily that content can also be reused and adapted. And what we see most of the time is that a lot of the material in its original form, if that original content is available, can be quite easily adapted to new forms, new usage, and done so very, very cost effectively for downstream opportunity. At the same time, it goes hand in hand if you're going to reuse content or try to be able to improve the timing of how physicians can receive that content. It must be ultimately measurable. So each channel has its own requirements. There's data that is being gathered. There's experts that within each channel are ensuring that that data has integrity. It's important that the content that be produced be aligned with that requirement for measurability. So all of the systems that are in place also have their role to play, and the content that we produce need to take advantage of those systems for measurement and usage. And at the end of the day, if we can improve all of the functioning of those other items, have great content, produce it quickly, deliver it to physicians in a way that is both relevant to them as well as delivers a user experience that is delightful, and effectively be able to replay that in an adapted manner on a localized basis over a period of time, we can drive that cost of content much, much lower. So we can then, the more we can turn that cycle of production more easily through automation, the more easily that we can reduce that content costs and try and do more with the material that we have available. So as we tie these components together, being able to focus on how to take advantage of omnichannel, vHealth has really spent the last couple of years in applying these learnings to this multi-channel environment for the purposes of being able to create and adapt content across multiple channels. And the key here is not any one channel is necessarily better than the others. They all have different roles at different points in time. What we've created is a core capability, and with SciencePod, we're taking both ends of the chain, the creation of great content and the ability to move that content across channels and take into account whatever are the appropriate systems that are already in place, whether they be the Vivas of the world or IQVIAs or email or video or whatnot, be able to take that content and make use of it within an omni-channel, multi-channel environment. So there is adaptation that's required, but in this case, we do this without any need for additional programming, without any need for significant expertise. And the system that we've delivered and created, called the Smart Content Suite, which we'll share a little bit about now, allows us to do this very cost effectively to essentially make it much easier to imagine what you would like to have as an experience across a particular channel and the kind of content that you would like to use, and deploy it very, very effectively without having it resort to manual custom programming and long delays. So essentially the publishing takes care of itself. So what we'll take a look at quickly, and my colleague Jean-François is on the line, and he will show us through the Zoom interface shortly, is 3 examples. One, an automated conversion of an original content item to an email, and they're all within the context of content that would be useful within an event environment. 2, an example of improving the kind of experience that you can do with email. And it's not just by providing a video link. You can actually put portions of the video directly in an email, for example. So we'll share a little bit about that and why that matters and how that helps to triple the physician engagement when that is done. And third, we'll show you an example of how we tie all of the content together within an environment that has a great user experience, and physicians can easily consume the content. So not only are they seeing a virtual event, but they're also being able to partake in that virtual event in a user experience that it has a 3D interface to it. So I will try and connect through this meeting platform with another meeting platform. So you should be able to see my screen, which Jean-François is sharing. He is remote and based out of one of our offices in Montreal, and he will share a few examples of transformation of content that literally in the next 5 to 10 minutes, we may not become content experts, but we'll certainly be able to demystify some of the cross-channel content game. Jean-François?
Yeah, thank you, Mark. Okay, so can you hear me okay?
Yeah. Yes, we can, thank you.
Okay, great. So what we're looking at here is the Smart Content Suite platform. So here it's where we bring in the original source document. So all type of original source documentation can be brought in here. The example I'm going to show here is a PDF brought in and how we have access to all those layers and then eventually, as Mark mentioned, converted to another channel and then be able to be editable. So the first section here, I will take an element, a PDF that came from Viva. So this is a Viva PDF.
So most of the content, when it is approved, obviously most companies are using promo mats for their approval process. And if they're not, then they're using a system that is similar. The vHealth platform connects very easily to any content source, whether it's Viva or other. And here we're seeing an example of automatically transforming a file that has been handed off by a SciencePod effectively, or an agency that has used SciencePod to develop the content and has already automatically created an output email from it. So that took about 15 seconds to do, and Jean-François will show us how we can then manipulate some of the material a little bit more easily. Jean-François?
Yeah, so that same document is the same one that was brought in here in the, now I'm switching to the Smart Email channel. If I now want to see and have access to all the layers and be able to make some edits, I'll open the editorial tool. And we can see here that I have access to all the elements that were behind. I'll make just a few edits behind.
And the point of showing these edits is not so much that everybody on the meeting today will necessarily make these edits, but to fundamentally understand that editing content and driving the production for any particular digital output channel usage is no longer a delay game or something where you should have significant hold up by either a business process outsourcing team or a local agency or what have you. Any of the materials can be easily produced, and it's that simplification of the production cycle that then allows us to spend a little bit more time on ensuring that the content can be pulled together in an event interface that is interesting. So here's an example of that same change that Jean-François made quite quickly. We took a file that was in a PDF format. An original agency would have designed that file. We brought in that content into the system. It was transformed into an email. We then made changes because we need to update the webinar date. It's actually October 8th, and we're ready to go. So we have that content that is we can send back for approvals, and that channel is easily managed from within this event. Jean-François?
The second part I'm going to show is for a video. So here's the original document template where there is a video associated to it. And what I want to do is I want to create this and use it across channel or in another template. So there's a video that's being done here and I want to use it somewhere else. So I already did the example ahead of time. So I want to use this example in another template, which is this one here, the Smart Event Welcome. So I can go into this template and just drag and drop the video that was created somewhere else into the specific template. So I can go in here and have access to my videos on the side. Just a simple drag and drop. I save my element, my template.
And what's nice about videos in an email is generally 99% of the time when you receive a video in an email, it's just a static image or a link that then the physician needs to click and go. By using the smart content system, what we do is we enable a preview of a video to actually be in the email. So the physician sees the content without having to tap anywhere. They're able to actually witness the material just having the email open, and they'll see those key messages. They'll see the critical items of that clinical summary. They'll see that relevant content playing in their phone, where 70% of the emails are opened, or on their desktop. And if they want to, they can click on that and go beyond the preview and experience the full video or interactive content. So this allows what Sabine was talking about, which is the ability to deliver the messaging in a way that's consumable. You give the physicians a bite-sized chunk that they can see quickly in between patients, and if they are interested, they'll come back to it and tap on it in order to then experience the full aspect of the content. So in order to raise the engagement across the board with everybody now receiving emails of some kind, it's really important to really target those messages and use the media and the technology to its advantage. So our system allows us to manipulate the content very easily and take material that was originally not defined for video and actually use it in video and tie it into email quite simply. Jean-François?
Yes. For the last part, I would like to show how we manage different fonts. So all type of fonts or any customization can be utilized in this tool. So in this example, what I'm going to show is we have access to Chinese fonts in here, and we are able to also add any custom fonts in the system as well. So if I take these elements, I'll just show an example a bit higher. But I can show how these Chinese fonts are used. So this is the Chinese font. If I want to reuse or add more Chinese font, we have access to the editorial here. Very simple to add any fonts that are needed in the system. And then I could preview again that example and see how the placement of the Chinese fonts are.
So very often what we are in the end, what we're seeing is that from a single piece of content, then local derivations, localizations, and updates and materials, and it extends down to the languages that are being used and the various fonts that are used as well. By being able to take content in its original form, however it has been originally designed, we bring it into the system, we're able to manipulate it in any of the various ways to make it very simple to reuse the same content in other languages, other updates, and other materials across the board. So that allows a lot more flexibility to be able to deploy the content very easily, and also deploy all the materials that are required to even run an event across different languages and different locations as well. Okay, thank you, Jean-François.
Thank you.
I'll share another example shortly. So this is an example of an interface or event capability that we run. So we take all that content production that's available, and we've brought it into a space that we call Smart Events. And what Smart Events allows us to do is essentially we've tied all of the material into an e-venue where there is an auditorium for speakers, an exhibition hall for handling sponsor exhibits, as well as a networking lounge. And there's a bit of motion, there's a bit of function here. There is audio as well. So it allows physicians to experience a webinar in a very studio-oriented context. So they're able to feel that the virtual event is delivering great meetings and messages, but also delivering the opportunity to have persistence, witness different sessions at different times, breakouts, and question and answer, but also do that within an environment that is something that's geared to them, and they can also take advantage of any of the audience reactions and something that's a little bit more visual, raising the game again, so that the impression that physicians have of the content that they're receiving is also tied to that user experience. So it's easy to run. It's very straightforward for them to participate. It's really just click and go, but it allows them to have all of the access to whatever interactive materials, whatever clinical highlights and summaries, the libraries that might be available are all brought into this smart event context for participations by physicians. And that aspect of tying the content back to the experience is absolutely critical. So our approach to this has been, what we identified a few years ago was, if we can help the digital transformation by simplifying the production, if you will, of all of the digital channels, then we can take advantage of all of the technologies that are out there to really raise the opportunity for engagements that are compelling, that are interesting, and help drive knowledge, so that ultimately physicians are making the right choices for their patients in the office. And we think that that ties across the board to these elements of the digital omnichannel IQ. The value of the content that we start with, the user experience that physicians are participating in, and then all of the speed and adaptation. That's what helps the plus side. And then along the way, because there's no manual programming that's involved, the cost per use goes down significantly. Sabine?
Thank you, Mark. I think it's a very compelling offering. The images speak for themselves, I believe, and I would pass the mic back to Jeremy.
Yes, thank you, Sabine. Thank you. Well, thank you, Mark, as well. That's obviously interesting to see the demonstration there and how that all comes together. I think, like Mark says, it's the simplicity of it is really one of the key things, that it allows the physician or the end user to really be able to focus on the content itself. And that in itself is really something that is becoming more and more critical, as the amount of information that's available to them, just as I mentioned in the beginning, is increasing exponentially. Being able to engage with those end users in terms of being able to deliver the compelling and the quality content in the first place is really a critical part to that. But moving on now, just to sort of wrap things up, we have had a few questions come in, so I'd just like to pose a few of those to obviously Sabine and Mark. One of those that came in, maybe I'll choose Sabine for this one, but someone's asked, in practical terms, how do we implement this solution that's been presented today?
So I mean, this is why the practical solution is really what we've created as a joint product between SciencePod and V-Health. Essentially, for any future virtual event that you may be attending, we have a ready-made package that would cover, on the one hand, all your content needs, you know, be it showcasing the latest clinical research in advance just to bring people in, be it organizing KOL video, remote video interview that can then be interfaced and repurposed through Mark's platform, in the form of an email with an embedded video, in the form of any form of web interface or any other interface, even the broadcasting of the video interview during one of the auditorium sessions during the event, are the many ways in which we can practically implement this solution. So it's all about tying it to a particular event where you'd have a package of content, plus the ability to use Mark's platform to really make the most of your content and make it as engaging as possible in the format that healthcare professional, physician want to consume it.
Lovely, thanks, Sabine.
Anything to add to this?
No, I think you answered it perfectly. It's a very straightforward package. If there's particular, I think what's interesting about the events is that events, they've changed because of the COVID environment, but there's still a moment in time. and that moment in time allows a lot of bringing all of the marketing materials or the content together. But now in the virtual environment, we can give it a much longer tail. So we can create a great event around with all of the content, be able to use the facilities to drive the experience, not just during that session or during that day, but be able to drive the follow-ups and the persistence of that event and the knowledge bearing a lot further. So that's what's exciting. And so if there is a particular event, then our teams jump on the phone, and usually that's how we sort it out.
Super. Thank you, Mark. Thank you. So another question that's come in, someone's asked, in my role, I deal with a lot of complex data. How could I apply such technology as being offered by V-Health? How could we offer to them? So Mark, could you maybe fend for that one?
So normally the content has been created, and you may have content that you want to be able to target to different segments of the audience. Previously, that might have been easy to do from an email perspective, but it might have been more difficult from other channels getting involved or tying videos or presentations together. So our system allows that to be much easier. We can create multiple segment views to those journeys, and all of the digital content that's associated with those physician journeys can be produced very easily. All of it can then obviously be localized across different markets very cost effectively, and that allows that material to have a greater relevance for those individual physicians when they do experience it. And in the event context, obviously allows you to have slightly different perspectives for physicians when they have certain topics in mind, and they want to be able to click on materials. They'll see something that's a little bit more relevant to them during that experience.
And if I may add to this, just in terms of the original data and the way you present things, I mean, our content creation teams have the ability to do data visualization. I mean, this is what we routinely do, you know, in the shape of infographic and things like that. So, so that the various infographic could be adapted to the various segments that will then be targeted.
Okay, thank you, Sabine. Lovely. So someone else has asked also, do we have any data on when HCPs are engaging with certain types of media? So are there any sort of, I think by that, are there any sort of patterns during the day where certain types of media are preferred at certain times? And they've also asked, are there any patterns to that? Again, maybe Sabine, you could share a bit of insight there.
Yeah, so we've been privy to a number of survey on that question, and it's very clear that video tends to win the battle at the moment, partly because healthcare professionals have got so little time, and they're confronted with so much text-heavy content otherwise that they tend to prefer these sort of more informal formats. In terms of the time of the day, we know that lunchtime is always a good one. Breakfast, lunch, and dinner tend to be good times, and then in between patient are the slots where, you know, they sneak it in.
Okay, lovely. Mark, anything you'd like to add to that?
Well, when we started my previous company, we had a lot of measurements of which days of the week were most useful, and there was a lot of consumption on weekends, and Tuesday nights seemed to be very popular with certain types of specialties. But now what we're seeing is a lot more of what Sabine is speaking about, which is grazing throughout the day, being able to get snippets of materials, be able to consume them, and then coming back to something a little bit later. So gone are the specific examples that say only, you know, invite oncologists on a Tuesday evening. Now it's really important to ensure that you're measuring that content, that your execution is also measured through the platforms that all of the companies have in place today, and that any content that's being produced, as we do, already adheres with those platform requirements. So that way, all of the data is being gathered properly, and you can optimize any of the campaigns for, you know, Wednesday morning or Tuesday afternoon.
Sure. Okay. Well, appreciate that. Thank you. So I think really looking at the time, there are a few more questions, but I think with the time kicking on, it's probably a good point to end the session there. But really just as a closing note, I'd like to just say that as of next week, we actually will be officially launching our virtual Congress programs. So this will be a dedicated series of multi-channel programs designed to be deployed at virtual congresses. They range from a full scope of digital assets for the event with options for small, medium and large events to a more dedicated program for any symposiums, abstracts, posters and oral presentations that you're aligned with. As it happens, I do have some preview information available, so if anyone is interested in that, please feel free to drop me a note, preferably, I guess, on email. Contact details you'll find on the website. But really, that will all align in with what you've learned today and the technologies and what we can offer from SciencePod's point of view as well. So just to finish by thanking you all very much for your time. I hope today's session will really prove a great asset to all of you in the coming weeks. So thank you again and take care.
Thanks, Jeremy. Thanks, Mark. Goodbye.
Thank you.
Thank you.